Welcome, friends. Thanks for tuning in as we tackle your questions about fall COVID vaccines. I'm Dr. Chana Davis. I'm a geneticist and contributing writer at Those Nerdy Girls, and I'm joined by Dr. Jenn Dowd. She's our awesome editor-in-chief and is one of the original Nerdy Girls that built this organization back in 2020. Jenn, can you introduce yourself?
Yeah, sure. Thanks, Chana. I'm Jenn Dowd, and I'm an epidemiologist, a demographer, a nerdy girl, and I'm a professor at Oxford, so an American expat over here in the UK.
Well, thanks for making it work time-wise. I think it's like Friday evening for you, right?
No place I'd rather be.
So just to let everyone know what to expect today, we've got a wide range of questions. We're going to be talking about which COVID vaccines are available, who they make sense for, why they still have benefits for a very wide population, when you can get vaccinated or when you can/should get vaccinated, and how to go about doing that. We're going to be focusing on the US perspective because that's where most of our audience is, but I'm here in Canada and I'll be chiming in about the Canadian perspective, and Jenn, you can chime in about the UK where it makes sense. And I think you'll find from this international perspective that a lot of these questions don't have black and white answers. There's a lot of grayness, and we don't have to stress too much about getting things perfectly right because there is no perfect answer to many of your questions. So let's dive in with the most straightforward question we have is which COVID vaccines are going to be available this fall?
Yeah, so the good news is the last couple of weeks have brought the approval in the US and lots of other countries of the updated mRNA vaccines. So our familiar Pfizer and Moderna are now available. And the Novavax vaccines, which are the more traditional protein-based, was also approved just last week here by the FDA. And so all of those should be very quickly kind of shipped out to pharmacies and available for you to choose from. And I should say that all of these are updated to match better the current circulating strains. So compared to last year's strain, which was XBB, the mRNA vaccines are targeting the KP2 strain of SARS-CoV-2, and Novavax is targeting JN1, which is kind of apparent to those lineages. So in the preliminary studies that the companies have released, these are neutralizing current variants, KP3.1 variants, quite well. So we think it's a good match.
That's exciting. This is, for anyone who's thought about vaccines and aware of flu vaccines and trying to match strains, it is not an easy feat to update a vaccine to match circulating strains. And it's so exciting that we now have an mRNA platform, a new technology that allows us to update much more quickly. So this is a real coup.
Yeah, absolutely. And we know there was a little debate and drama about which strain to select. It's always a bit of a gamble, but I think we're going to learn a lot each year. And we know for sure that this is a lot closer to the current circulating strain than last year's, vaccine. So it's important for us to keep updating.
Yeah. So I'm going to drop a couple of links in here if anyone wants to, nerd out a bit on tracking the vaccine landscape. I can give you some links that you can do that, and also a Nerdy Girls post about approved vaccines. So now that we've set the stage, let's move on to who is eligible or what are the current vaccine recommendations this fall.
Yeah, so similar to last year, the US CDC has recommended that everyone ages 6 months and over should receive the updated COVID vaccine. So that's a pretty easy generalized recommendation. And we just want to point out, that a lot of people think it's not that important for kids to get the vaccine. But there are a lot of children, especially very young children, still getting severe COVID and hospitalized each year. So it's not true that kids, don't have very severe COVID. They can really, really benefit from this vaccine. And the other groups for whom the vaccine is especially important for, as we know, are anyone at high risk for severe COVID, which can be specific chronic conditions. But I want to remind people, especially as a demographer, that age is actually the strongest risk factor for severe COVID and COVID mortality. And so if you're over 65, it should, just be a no-brainer to keep up to date on your vaccines. And I know I have relatives who tell me, well, I'm 75, but I am very healthy. I probably, am not in that category of high risk. And I just want to remind people that age in and of itself, no matter what, does affect your immune system. And so even if you tell me you're 80 and climbing Mount Everest, I want you to get that COVID vaccine, because it is really about the interaction of the virus and, the aging immune system. Go ahead.
I was just going to say, we had a recent post on immunosenescence, didn't we?
We did, yes.
Immunosenescence. A fancy word for it.
It's a fancy word for age-related immune decline, and we're learning more about it. But it's unfortunately a fact. One fact of aging is you don't mount as good of an immune response to vaccines or infections, and so you need all the extra help you can get, even if you're otherwise healthy. And another category, that's really important then, is because there's also immunosuppression that happens during pregnancy. So that's just another group of people we want to be really conscious that this is an important vaccine to get if you're pregnant.
Mm-hmm. Yeah, that in that immunosenescence or vaccine response aging post, it mentions that sometimes vaccines are actually formulated differently for older populations to make up for that. So anyways, just to echo what you said, that just if you're healthy but you're older, your immune system is still different than a younger adult.
Absolutely.
So yeah, in Canada, the recommendations are similar, although they have they basically say that it's recommended for anyone who is unvaccinated or in any of these higher risk categories, and it's available for the general population 6 months.
Okay, so slightly weaker recommendation, but then the UK is an interesting counterpoint, because it's actually only being given through the NHS, which is the typical distribution for flu vaccine and everything for people ages 65 and over, or people in care homes, or kind of clinically severely immunocompromised. So it's not available through the typical health service for those under age 65, but just since last spring in the UK, there has been private availability of COVID vaccines for the first time. So at least there is some pathway now for people under age 65 to get that updated shot in the UK.
Yeah. I posted a link in the chat to a list of, people with certain medical conditions and COVID risk factors, like which medical conditions are we talking about? And it's a very long list that I don't know the number, but I would like to know what percent of the population this captures, because it's a very long list. Cancer, kidney disease, liver disease, lung disease, cystic fibrosis, diabetes, obesity and overweight. I mean, that's a huge fraction of the population. So I think it's
that pretty much covers everyone in the US right now.
So, even if you think you're not at high risk, you might be more than you realize. So maybe that's a good transition to let's talk about why vaccines are important, even for people that don't fit the high risk category. So I'm going to give you an example of a reader question here. Rachel asked, I am low risk for severe COVID. I'm 35, no underlying conditions, and I'm healthy. I've gotten every shot until now. Is the primary reason to get a COVID shot to provide protection against infection for a few weeks? What is the upshot for people like me?
That's a great question, Rachel. And I'm really glad that you chose to get all of the shots up until now. That's a really great thing. But I think your question resonates for a lot of us, because a lot of us are in the same boat of feeling like we're not high risk and wondering, we've also seen that getting the shot doesn't mean for sure that you're not going to get the infection. So you might start asking kind of what's the benefit. And, I guess I'll give sort of my why personally, as being someone generally in that category, a little bit older than you, Rachel, but still. And my why for why I will get every updated shot that's available to me is first because it does really lower your risk of infection in the short term, and that may be 2 to 3 months. Right now, we might get better vaccines as time goes by and we learn. But COVID infections, as we all know, can be very disruptive to our lives. Besides just feeling really awful, they can disrupt, travel, special events. I think we've all heard a lot of these stories by now. So, even though they're not perfect and don't eliminate the risk of getting that infection, they dramatically reduce it. And so I really value, lowering that chance as much as I can, even in the short term. And then following on from that, if I lower my risk of infection, even for 3 months, that really means I'm lowering the risk that I transmit to anyone around me for that period of time. And, I wish that durability were longer, but I will take it as long as I can get it. And the next reason is really to reduce the severity if I do get infected. And I think we don't focus on that for people who we think are not maybe at risk for hospitalization. We have that good data that the vaccines reduce your risk of, outpatient visits, urgent care, hospitalizations. We don't have a lot of data on, what happens to people who are just home feeling sick because, they're not measured as entering the healthcare system. But if we think of severity on a continuum, which I think, makes sense biologically, it stands to reason that if you're infected, your severity, even, that's not at that threshold of being hospitalized, is going to be less than if you had not, the counterfactual, if you got that same infection without a vaccination. Because it really is giving your immune system kind of a cheat sheet and a head start. And that I definitely want my immune system to have that if it's going to run into SARS-CoV-2. So, reducing your own severity, even if that wasn't going to land you in the hospital, I think is a big reason. And kind of, related to that, we do now have good evidence that, vaccination doesn't eliminate the risk of long COVID, but it is associated with reductions in the chances that you'll get long COVID after an infection. And so, any chance we have to reduce that risk, I think, is really important. And then finally, I guess I say why not? Because there's, very little downside. At least for me, I don't have strong reactions to vaccines as far as side effects. We know they're incredibly safe. They've been, so many doses of these vaccines used now, and we really understand the safety profile. So I feel like there's very little downside and lots of upside, even for lower risk individuals.
Mm-hmm. Yeah, that you touched on all the same reasons that I plan to get every COVID shot that's available. It's, slightly reduces my risk of being infected, significantly reduces my risk of more severe disease, and dramatically it reduces my risk of really bad outcomes. And then the long COVID is a huge benefit. And then for me, I also spend a fair amount of time with my mom and other, grandparents that come to visit, and I want to reduce my risk of spreading it to them. Because I have kids who are actually likely to have an asymptomatic. It's very easy for COVID to fly under the radar in our family because
Right.
it's mild. And so I would just rather reduce the chances that we have it.
No, absolutely. And if everyone in the family is vaccinated, that, that reduction in risk kind of multiplies. So no, it's a great strategy for everyone. Really important.
Yeah, in fact, my kids have had COVID a couple of times and it's virtually been asymptomatic, but there's been something subtle enough that's prompted me to test. And it's always been a time when my mom was about to come over or something. And I feel like we've had so many near misses. And as far as I know, my mom's never actually gotten infected. So, and it would matter if she did. So
that's incredible. Well, that vigilance must be paying off. So
yeah. Well, I love a good COVID test. We'll have to do another live on those. But here in Canada, they've been super easily available. I can go to the drugstore 3 blocks away and reach into a bin and grab as many as I want. So that's
amazing. Yeah, the US needs some more of that.
Yeah. It's a very different situation, I know, elsewhere. Anything else we should talk about on the why? I think I think Rachel is a great representative of your, someone who doesn't, if you fit one of the high risk criteria, the calculus is absolutely obvious. If you don't, it's more subtle, but it's still a net positive, what I would say.
Yeah, absolutely. And I think you can make similar arguments about the flu shot. The flu doesn't kill a lot of, otherwise healthy people, but I think I've always gotten the flu shot, in hopes of reducing, to reduce the risk that I'm just home for a week feeling awful and reduce the risk that I might, transmit it to a more vulnerable family member. So a lot of the same principles apply. And so I think if we can get that in people's mind as a good routine thing to do for themselves and for others, like that's where we're going to be going forward.
Yeah. We did get one question, which unfortunately I don't think I pasted the actual language in here, but there are some people asking for very specific numbers on how long will I be protected from infection? How much does it reduce my risk of, hospitalization? So I wonder if you could speak to those numbers, like some of what we do know, but also why it's impossible to give, a single numerical answer to a question like that.
Yeah, that was a very good but very demanding reader comment.
Yeah.
I was like, that is such a good question, but it would require a big epidemiological review to answer all of that. And I hope that people are doing that. But I think it shows that your question is right on for what's important. And I guess the answer is that, in the very beginning, we understood very well the efficacy of the vaccines from the clinical trials. And that's a very clean way to see the effectiveness. And, those were very early in the pandemic. So also virtually no one had been previously infected or had other vaccines. But now it's very hard to get those estimates because the question is always, what are you comparing to? Like someone getting the updated shot compared to someone who's had most of their shots, but not this updated shot. It's a very different comparison relative to the completely unvaccinated or vaccinated that we had in the past. And we have to estimate it more from real world data because we're not running trials every year on the efficacy because it just wouldn't be a good use of resources when you're, updating marginally a vaccine. So we have to rely on some of these real world studies, but there have been careful ones done in some of these large health systems. There were a couple studies coming out of Denmark and the Netherlands where almost everyone in the population is linked, to this administrative data showing, that the groups that got the vaccine, the ages that rolled out first really were protected from hospitalization for several months. I think the one in Denmark found a 76% reduced risk of hospitalization. And there were similar numbers, I would say, between 60 and 80% reduction for several months in different contexts, including Kaiser Permanente health system in the US. So, we're seeing really good numbers. And again, that would be comparing it to people who probably have had other vaccines and previous infections, but not just the updated one. So we definitely see a benefit of the updated one, and having had it recently, especially, is when it's most protective. So, but getting exact numbers, everyone out there now has such a different history of infections, vaccines, timing, that making apples to apples comparisons is getting harder. But I really look to some of this real world data each year to see what it looks like. And, the vaccines, and we would tell you, if we saw these studies and there was no additional benefit, it seemed, that would be important. And we would know that we didn't need to vaccinate everyone each year. And that can happen for other vaccines, perhaps, that you don't need as frequently. But we're really seeing that for COVID, it's important to have that recent and updated protection each year.
Yeah, on the Health Canada website, there was a one sentence data summary. I don't know exactly what studies they were citing, but they said that the updated vaccines, the last iteration, were estimated to provide 50 to 60% protection against symptomatic disease. So meaning you may get it, but you may not be symptomatic, and 60 to 70% against hospitalization. So those are,
Yeah, that's pretty huge,
yeah,
honestly.
yeah, and that
Yeah.
they just describe that in adults. So I don't know if that's age groups and so on. But anyways, that gives people a rough sense of like you're cutting your risk of symptomatic disease in half, and you're
Mhm.
dramatically reducing your risk of hospitalization. And
Yeah,
then,
and the one in the California health system also measured urgent care and just other outpatient visits short of hospitalization, and it also reduced that by almost 60%. So that is something that affects most people, a lot more, like whether you're sick enough to go to urgent care.
yeah,
So you can dramatically lower that risk.
yeah. And then we'll probably have to do some deeper dives on the timing. But what I've read from like summary statements, one from Johns Hopkins, they said strong protection against infection for up to 3 months and protection against severe disease up to 6 months, or out to 6 months.
I think that's consistent with a lot of what we're seeing. And I think beyond 6 months, it just gets harder to tell because that's often when the new variants are coming out. And so it's a combination of waning, like the time since the last vaccine and the new emerging variants. But no, I think that is very consistent. I think the data is showing that pretty consistently.
Mhm. Okay, well, let's move on and talk about COVID and flu, because this is a question a lot of people are going to be debating is, can I get my shots at the same time, and should I get my shots at the same time?
Yeah, it's a great question because we're getting lots of ads for getting our flu vaccines at the same time now. And certainly the CDC kind of updating these in the fall, I think, is hoping that these fall into some kind of synchronicity. But, the COVID keeps spoiling our plans and isn't falling into a very seasonal pattern. So that's one challenge. But it is, close to time to get your flu vaccine. And now the updated COVID vaccines are available. So I guess the first thing to say is, yes, it's completely safe and just as effective for each vaccine to get them at the same time. And we do, there are combined shots that are in development and we might see within the next couple of years. I would just make one, and I know you're going to maybe talk about side effects, but I want to make one comment about timing because we'll talk a little bit later about timing of the COVID vaccines. Getting it now is very reasonable given the current wave. But for flu vaccines, we do have a much more predictable flu season. And, there's some people who are concerned about if you get the flu vaccine too early, that protection might wane if we have, that peak season really starting in January through April. So, there's varying recommendations, but some consensus that I trust is that it's a little better to push towards mid to late October for your flu vaccine, if you're trying, for optimal timing. But we do want to say if getting in and getting them both done at the same time means that you'll get them for sure, then do that. Like the important thing is getting them, and you don't need to stress about the timing. But some people like to think very carefully about that. And in that case, you can wait a little more towards Halloween for your flu vaccine.
Yeah, that's sort of what I've read and heard as well, is that if you're practicalities first. So if you're only really willing to make one appointment, do it. Just go get both shots. But if you're willing to consider 2 appointments, probably that's more optimal in terms of protection overall, not because of the immune response to each one per se, but in terms of the maximizing the timing for each virus. I wanted to comment a bit about side effects because a lot of people, that's a big consideration. And there was a study looking at people getting the shots separately versus together. And they did find overall, more side effects when you get them together, which is probably not surprising. But it wasn't a dramatic difference. So it's just a very personal decision. Malia actually, one of our nerdy girls, got both last year, and she found it really knocked her out. And she was thinking next year she would probably do them separately. But then you have to plan 2 sick days. It's like plan 1 really sick day or plan 2 kind of sick days. So
Yeah, that's the trade-off. You can condense it into one day, and even if it's a little bit worse, it might be worth it. But it's definitely safe and effective is the most important thing.
Yeah.
So
Yeah.
don't hesitate.
Yeah. And they have kind of overlapping but slightly distinct side effect profiles of, COVID vaccines, typically sore arms, sometimes fever, chills, tiredness, headaches, flu shot, soreness, redness, and swelling at the shot spot, headache, fever, nausea, muscle aches, fatigue. So, it's so just expect and plan for the fact that it could be more uncomfortable to get 2 shots, but still manageable. It's not going to be unsafe or anything.
Absolutely.
Okay, so let's move on to the question that has probably come up the most, which is, when is the best time to get my COVID shot? There's been a lot of discussion about this, and I think that reflects the fact that there isn't a simple answer. So can you give some of the considerations? And
yeah, we've gotten so many questions, and it's just a function, I think, of the timing of this really intense summer wave right now of COVID has really thrown off the timing of these fall shots. So no, you're absolutely right that I think one thing to remember is there's probably not a perfect answer here about as far as getting it right away or waiting a bit, because each choice has a little bit of risk to it as far as not knowing when you might get exposed to COVID. So I think the first thing I would say is don't stress too much about the timing. Just get the shot. There's unlikely to be a perfect decision, so don't overthink it. But I know some people, do want to try to optimize, especially around important events or travel. And so we do have some ways to kind of think through your particular scenario a bit. And so the things that we recommend you kind of think about and walk through if you're thinking about whether to do it now or delay is when you were last vaccinated and infected. Whether or not you have household members who are immunocompromised or vulnerable, and also thinking about your potential COVID exposures over the coming months. And so just to dive into those in a little more detail, this has been a huge COVID wave this summer in the US and many countries. So I don't know if this is completely accurate, but I saw one estimate that as many as 50% of the U.S. population may have been infected this summer, and so whether it's exactly that, it's a big number, and so there's a decent chance that you've been infected recently, and if that's true, it makes sense to wait a little bit before you get your next vaccine. Again, there's varying guidance on this, but we kind of say it's best to wait at least 3 months before you would get an updated shot from your last COVID infection. In part, your immune system is already really revved up to fight, the infection, and you're not going to get an additional antibody benefit from a vaccine at that time. So it wouldn't hurt you, but you're really not going to get that additional benefit. Whereas if you stretch it out, it gives your immune system actually kind of matures in its response to that infection, and you'd have time, to stretch that out if you got the vaccine a bit later. And this is also similar if you got a COVID vaccine recently, which some, older people might have gotten in the spring or summer because they were eligible or immunocompromised. If you happened to get one in this summer wave, in July or August, you probably want to wait at least, 3 months between vaccines. You're eligible after 2 months, according to the CDC, but it probably, if you kind of want to stretch that protection out a bit longer, 3 months is probably a safe interval.
I believe in Canada, you have to wait 3 months.
Okay. Yeah. And that does go to show that there's not hard lines on any of this. It's a little bit blurry. So I think 3 to 6 months after an infection or vaccination is a good rule of thumb right now. And I'll just add the point that I just saw in a recent Atlantic article that this is another good reason to test right now. If you have a cold and you haven't typically been testing for COVID in a couple of years since it became less of a big deal, you might want to do that because it can inform the timing of your updated vaccine if you know that you've had COVID recently.
Mm-hmm.
So I thought that was a really interesting point that I hadn't thought about for testing.
Mm-hmm. Yeah, I wish you could get those COVID antibody tests. Like those do exist, but then I feel like they kind of disappeared. Where you could people.
Oh yeah, like see how high. Yeah, I haven't heard a lot about them because they were kind of to see if you'd ever had the infection.
Exactly.
So now everyone has. Yeah. But I'll run through a couple other scenarios, I guess, for timing. If you have not had a COVID infection or vaccination since last fall, which a lot of people are in that boat, it's definitely reasonable to get one right now because cases are still really high. Like we might be peaking, but wastewater levels in the US are still very high. You probably know a lot of people getting COVID. We're back to school, so there's, still a lot of transmission that can happen. So that's a reasonable decision if you kind of want to get that updated protection right away. And I would say the trade-off there, because there's always a trade-off in these decisions right now, is that your protection from acute infection might be waning around the holidays. And we've typically had a winter wave, but again, COVID's less predictable than the flu. So that brings me to another reasonable choice, which I think is you could wait a little bit to get the updated shot, more towards late October, November, if you want that peak protection to be closer to the holidays. And I think that's a decision I'm probably going to make because of some holiday travel that I have. And I think that's a very reasonable decision. In that case, because there's high transmission right now, you might want to just take some extra precautions to lower your risk until this wave, hopefully subsides a bit soon. And we've got, some links on those trusty prevention measures, such as good ventilation and masking in crowded places, et cetera.
I'll drop some of those links.
And then we did get a lot of questions of people's very specific situations, which again is hard to answer. But there were some common themes about, can I get one now and in a few months? And that's a great question. And we'll just say right now in the US, there has already been additional doses approved for people who are moderately to severely immunocompromised. They will be eligible, for this updated dose and then an additional dose at least 2 months later. And that's the same as last year. So, that hasn't changed. So that's possible. If you're in that category, you could choose to get one now and also one closer to the holidays. But what's different so far from how things ended up last year is that there's currently no recommendation for over 65s. The recommendation is to get the one updated shot. But last year and the year before, people over 65 could then get an additional shot, which I think that recommendation often came out in the spring. And the CDC has actually stated that there's no recommendation at this time for that second shot for over 65s. It could be, they're going to watch what happens this year. They said that recommendation could come later, but currently, if you're just over 65 and not immunocompromised, you can't yet 100% count on that additional shot being available. So I realize that's tricky because it makes planning these things just a bit harder, because some people want one now and some have a trip, in March, and they really want to know if they should do, one now and one later. And I really sympathize with that, because I think it would be nice if we had that information now so people could plan. And I'll just say there's also some gray area as far as, getting that additional shot, because the CDC also states that the immunocompromised, status is something that you attest to yourself. There's no very specific documentation, but where that can become more practical is whether insurance will cover that additional dose. So that's just something to keep in mind. If you're trying to go get an additional dose and you're not sure if you qualify, you might be able to get it depending on the physician or pharmacy, but whether it will be covered by insurance is an open question.
I want to just read a couple of readers' questions, just so shout out to our readers for actually, driving our content and inspiring us to keep providing information. So along the lines of what we just talked about, Rachel asked, if we haven't had a recent infection or vaccination and decide to get the vaccine in early September, could we theoretically get a second vaccine right before Christmas? Another one, I'm immunocompromised. This is Mary. I'm immunocompromised. My last COVID vaccine was last fall. If I get the new shot ASAP, can I get another one in 4 months? Thank you. Another similar one from Susan, 70 years old, up to date with my vaccine, never had COVID. My question is, can I get the updated one now and again in January? A 4-month interval I'm trying to cover for the holidays.
So a lot of people want to do that. And and so the bottom line right now is if you're in that immunocompromised category, you can plan for that. If you're just over 65, it's a little trickier. Yeah, you don't obviously have that choice right now.
I will add one more that's basically the same question from Lisa. 72-year-old female, going to be traveling in spring 2025. Should I get the new vaccine ASAP and get another one in March prior to traveling? And some thank yous in there. So
I mean, that's tough because I think that would be a reasonable strategy. And I would anticipate that, the CDC will once again offer spring, boosters for that age group, but it's just, we don't know for sure. And it's, unfortunately, that guidance is not there quite yet.
Yeah. And I just wanted to note that Claire asked, is there any downside to getting the COVID vaccine twice in less than 6 months? So is there any safety concerns? There's definitely been talk about, is there an issue with getting so many COVID shots?
Yeah, I think, no, it's, some people were worried that you're overstimulating the immune system. And I would say we have no evidence, of that from basic immunology. Our immune systems get stimulated all the time. So, but interestingly, we had this really kind of fascinating case that actually got written up in a scientific paper because there was a 62-year-old man from Germany who got 217 COVID vaccines over 29 months. And this was my favorite part of the article. It said for, quote, private reasons. So we don't know exactly why. And he was actually, getting in trouble in Germany for, kind of fraudulently obtaining all of these, but they did drop the charges and instead, asked him if they could look at his blood and see what happened to his immunity. And apparently he was completely fine and was still getting additional, boosts each time he did get a vaccine. There was an elevation. And he had never had COVID up to that point. But so not recommended for 217 doses, but it was an interesting data point that the chances of overwhelming your immune system is low. So anyway, no, I would not worry about getting 2 within 6 months.
I just dropped in a link to a Stat News article that interviewed various experts about this whole timing and had some good discussion in there. I was going to say, I can't remember if we mentioned this earlier though, but in Canada here, often there's been a recommendation for like a longer intervals, slightly different guidelines in the States. And part of the rationale is that a longer interval actually does give you a better boost. And the question is how much? So if you waited, 6 months after infection versus 3 months, you'll get probably a stronger immune response, but how much stronger? I think it's more like, I'm nervous about putting up numbers, but I feel like I did look at some of the publications and it's, 10% stronger or something. But if you're thinking from like a public health system perspective, it makes sense to say, oh, well, we can squeeze out, give everyone a 10% boost if we tell everyone to wait another month. It's different from the system's perspective versus individual perspective.
Yeah, absolutely. And I think, we're still in very early days with COVID and figuring out the cycling, the time, how often we're going to have big waves. And I really do hope that everything settles down into being more predictable. And then I think we'll be able to help people optimize the timing much better.
Yeah.
that's the dream anyway.
So I think we should close here with a very practical question of how and where do I get a shot? Am I going to have to pay for it? I know the answer is going to vary regionally here, but maybe you can speak to the US.
Yeah, I mean, I'm not there physically right now, but no, you're the vaccines we have heard are vaccine appointments are available in the typical places like CVS and Walgreens, and I assume other places, where you've been getting them in the past. They've been shipped out, and supply seems good. So go try to make your appointment. And as far as coverage, because this has changed over the years, these used to be, completely free without any regard to insurance during the emergency authorizations of COVID. But now, it's a little bit different. So the vaccines should be free for most people. They're covered under Medicare, Medicaid, and most insurance policies. So, hopefully that covers a lot of people, but we know that doesn't cover everyone in the US. So we will drop some links for a couple other programs for children under 18. There's a Vaccines for Children program. We also know that local health departments and other kind of local organizations will often try to do vaccine drives and make them more available. And for uninsured adults, last year there was something called the Bridge Access Program run by CDC. That covered this, even if you're at a pharmacy like CVS or Walgreens. And, the last we saw on the website, that program only went through August of 2024, and we haven't heard whether that's going to be renewed again. So that's the only kind of question mark. But we hope that you can get the vaccine free in most cases.
Mm-hmm. On the CDC website, it says to go to vaccines.org to find local pharmacies offering the vaccine or to contact your local health department. So
great.
We've dropped links to those as well. In Canada, similar situation. I've dropped a link from Health Canada, how to get vaccinated, through your local healthcare system. And vaccines, COVID vaccines, I'm happy to share, are freely available to anyone in Canada. At least that's what it says. So hopefully everyone can actually physically get access. Is the challenge sometimes.
That's great.
Yeah.
And in the UK, like I said, it'll be free for 65 and over and should be available privately if you're not 65 or over. But I will say the private fee is much less than it is in the US. It was, I don't know, 50 or 60 pounds in my experience.
Okay. Well, we are not only out of time, but over time. But I think this is the topic that's been the number one in our question box. So I think it makes sense for us to dedicate extra time to this. So thank you for tuning in. Thank you, Jenn, for being here. And if you want to keep up with our content, sign up for our newsletter at thosenerdygirls.substack.com. And you can also browse our archives on the Nerdy Girls website, thosenerdygirls.org. And you can also submit questions there for future Q&As and posts.
All right. Thanks, and have a great weekend, Chana.
Yeah, you too. Take care.
All right. See you.
Bye.